Alrighty, today we're going to be doing a demonstration on IV push medication administration. So the first thing we're going to be doing is checking the physician's order and the MAR to make sure that it is correct. Next, we're going to go ahead and go into the patient's room and identify the patient and check for allergies and explain possibly the procedure. Also going to be checking vital signs if that's what we need for the medication that we're administering. And we also want to make sure that the IV is compatible with whatever the primary line may be infusing. We want to make sure that there's no crystals forming, obviously, when we push the medication. So after we've gone into the patient's room, we're going to go ahead and go into the medication room. We're going to go ahead and go to the Omniseal and pull out the medication. So for demonstration purposes, this is going to be my 5 milligrams, my Dilaudid, 1 milligram per ml. And then on the back side, which is the pink side, it's gonna be my normal saline. So pretty simple. We've got the normal saline right here. Next, I'm gonna go ahead and start off by just cleaning the vial tops for 15 seconds each. I'm gonna be grabbing a needle that is about an 18 gauge, it's a little bit bigger. It's easier for the medication to be drawn up. Once I've cleaned, 15 seconds has elapsed, I'm gonna clean both, obviously, the normal saline and the Dilaudid. So in this case, it's gonna be 1 milligram per 10 ml. So I'm gonna need to draw up 10 milliliters of fluid. So I'm gonna grab a 10 milliliter syringe. And then the Dilaudid is 1 milligram per ml. So I'm gonna draw up 1 milliliter of Dilaudid from the Dilaudid vial, and then 9 from the normal saline. So in order to do that, I'm gonna grab this guy. Normally it would be in a package, so I would unpackage it and then it would be sterile and then I could connect it. If it weren't, then I would obviously take an alcohol swab and clean it for 15 seconds. So we're gonna connect it to the needle. We're gonna draw up 9 milliliters of air to inject in the saline first, and then we're gonna go into the Dilaudid vial. So we've got 9 milliliters of air. The vial has been cleaned. We're gonna push it in. And then we're gonna go ahead and take it out. Draw up 1 more milliliter of air. Switch it to my Dilaudid. Administer the air. 1 milliliters in. And then we're gonna take this and we're gonna pull out 1 milliliter of fluid into here. Making sure that there are no air bubbles. Okay, so we're good here. Got no air bubbles, and we've just drawn out the the Dilaudid. I don't know if you saw that spraying everywhere, but if that were to happen, I may have to just redo everything. So now we're gonna withdraw 9 milliliters of fluid from our normal saline to make for a total of 10 milliliters of fluid in my syringe. So I'm gonna have to drop slowly. This is my normal saline vial, just for clarification. There's a lot of resistance because it's been practiced on, so. And one thing I'm keeping in mind is I don't want to draw past the 10 milliliter mark, because if that happens, then I'd have to push some fluid back in, and then that could possibly be some Dilaudid. So I'm making sure that I do not withdraw more than I need to. So I'm right at 10 right now, and I'm making sure I don't have any air. So I have 10 milliliters of fluid. And I'm gonna go and withdraw. I'm gonna go ahead and recap this with one hand, making sure I don't poke myself. So I've got this. Let's go ahead and connect it right here. So I've got that. One thing I need to do is label my medication. I want to make sure that I label everything correctly. I don't want to have any mistakes. So we're going to go ahead and do 1 milligram per 10 mLs of Dilaudid, and then I'm going to put date, time, and my initials. Okay, so that's all set here. Next, I'm about ready to go into my patient's room. Once again, I'm just going to double verify that the IV fluid is compatible with whatever is running. I'm gonna grab 2 syringes These are gonna be imaginary 10 milliliter syringes. I only have 5. So we're gonna grab 2 10 milliliter syringes for flushing, and then my medication, and then a pair of gloves, the actual medication, and alcohol swabs to make sure I clean the ports with. So next, we're gonna go ahead and go into the patient's room. So we're in the patient's room. Knock, 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 hand hygiene. Once again, verify the physician's order, identify the patient, make sure they don't have any allergies. Explain that this will take about 10 to 15 minutes just by the time we're all said and done. I'm gonna go ahead and, as I said, provide privacy. I've already washed my hands. Go ahead and go to the computer, scan the medication, so that's already up and opened. Next, I'm gonna go ahead and go to the patient's bedside. I'm gonna go ahead and stop the primary IV fluid that is running, making sure that's on pause. And if this port were on the side, I wouldn't need to disconnect it. It could just be on the side. And then I would just administer straight from here. So I would take my alcohol swab. Sorry, I'm jumping ahead of myself. So before I do that, I'm gonna go ahead and assess the site for hand hygiene real quick. We're gonna check the IV site for redness, swelling, edema. Ask the patient if they have any pain, and anything else that may be abnormal. It may even be a little bit cool to touch because fluid could be infiltrated. So we're gonna just be assessing that, a little bit of palpating. And then we're gonna take the port, we're gonna clean it with my alcohol swab right here for 15 seconds. Once 15 seconds has elapsed, we're gonna grab just my regular saline syringe. And we're still checking for patency here. We haven't verified that yet. So this is sterile, sterile, sterile. And then we're gonna aspirate and check for blood return coming from here. So go ahead and aspirate. I see blood return, so I'm gonna go ahead and flush the medication, just at a normal rate. And I'll set that down. I'm gonna get my medication ready now. So I'm just gonna loosen this. So it's all ready to go. Medication's there. I've already done my medication rights, making sure it's the right dose, time, route, patient. Medication's not expired. And then I'm gonna go ahead and disconnect this, put this away, grab another alcohol swab, clean for 15 seconds. Once I've cleaned for 15 seconds, I'm gonna go ahead and get my medication ready. Go ahead and connect. And then, so this medication is supposed to be administered for, the 10 milliliters is supposed to be administered over a 2-minute time frame. So it's gonna be 2.5 milliliters every 30 seconds. So I'm gonna be timing on my watch that every 30 seconds there should be about 2.5 milliliters less. And then halfway done should be about 5 milliliters, and that should be a full minute, and so on. So we're gonna administer that very slowly. During this time, I'm gonna be asking the patient if they are experiencing any pain or if they see any swelling. I'll be looking as well. And then that'll be the administration of the actual IV push for the actual medication. For demonstration purposes, I'm not gonna push it over 2 minutes because then this video would be an additional 4 minutes long. So we've done my medication, pushed that over 2 minutes. I'm gonna go ahead and clean the hub again for 15 seconds. And then I'm gonna grab my regular 10 milliliter syringe. I know it's only 5, but I'm gonna pretend it's 10. Uncap it, still clean the port, and connect. And I'm gonna administer this over the exact same amount of time that I did the other medication. It's gonna be 10 milliliters over 2 minutes, and it's gonna be 2.5 milliliters every 30 seconds, and 5 milliliters every minute. So we're gonna go ahead and do that. Once again, still asking the patient if there's any pain, if they have any other sensation, or if I notice anything abnormal, then I would possibly stop and assess for infiltration. Once that's done, I'm gonna go ahead and uncap this, put this to the side, and then we're pretty much all finished. We just need to open the IV line, let the fluid start running, recap this if I need to, if they have them available at the hospital, take off my gloves. Actually, before I do that, I'm gonna clean up a nice area. Put these in the sharps container in the appropriate manner. Throw away the gloves, perform hand hygiene. I'm gonna wait at the patient's side for about 15 minutes. I'm gonna recheck vital signs if I need to. I'm gonna be just with the patient, making sure that they're okay. So I'm gonna be documenting the medication given, the date and the time, and the patient's response, and so on. And that's how we administer an IV push medication. Thank you.